Hello and good morning. My name is Amanda, and I am the Community Outreach Coordinator here at the Missouri Poison Center. And today, on this very cold, wintry day, I have with me Justin. He is one of our pharmacists and certified specialists in poison information who answers many of the public and professionals' phone calls. So we're going to talk today about medicine dosing tips for parents. And so we'll start off with, I'm going to let Justin take it away.
All right, thanks, Amanda. So why does medication safety matter? So one study that was funded by the National Institutes of Health found that more than 80% of parents made at least one dosing error when dispensing liquid medicines for their kids, and that 68% of the errors ended up in overdose situations. The study also found that most errors occurred even when parents used a measuring cup. And there were fewer errors when parents measured the dose with an oral syringe, which is the method recommended by doctors, pharmacists, nurses. As far as over-the-counter medications for kids goes, just because a medication is available, quote unquote, over-the-counter doesn't mean that it can't be dangerous. So you should always think twice before you reach for an over-the-counter medicine. Make sure your child even needs it in the first place. In many cases, medication is not needed for a quick recovery, especially with cases of the flu or a common cold. If you're unsure whether your child's symptoms need medication, it's always best to check with their doctor and ask them. You should always read the directions first, follow the exact directions and dosage recommendations for weight rather than age printed on medication labels. Had situations with kids that are big for their size and they're getting underdosed. Because you're using the weight or the age rather than the weight. And we've had situations where kids are small for their size and they're using the age and they're overdosing. So always weight is more important to follow than the age. You should always check the active ingredients of medicines. Read the active ingredients to avoid an accidental overdose. Don't give a child acetaminophen, otherwise known as Tylenol, or ibuprofen, which can be Advil or Motrin, when they're taking other medications that may also contain either. This includes over-the-counter cough and cold medicines, which typically have 3, 4, 5 different medications included in them. You should always know the total daily dose that's recommended. You should always ask your physician or pharmacist what that maximum daily dose is for your child based on their age and weight. Over-the-counter cough and cold medication is not recommended for kids under 6 years old, due to unwanted side effects and just not being studied in that age range. Cough and cold medications are of little benefit to very young kids and can have serious side effects. If your child has a cold or is congested, you should first try something like saline nasal spray, saline nose drops, a humidifier, steamy shower to help relieve those symptoms without medication use. And you should always give children's medication only to your child. Never give a child an adult version of a medication because a lot of times the dosages are different. Moving on to safe liquid medication dosing. In this picture, you'll see some oral syringes, which are the most common and the best way to measure accurate doses of medications. You should use that dropper syringe, medicine cup, or dosing spoon that comes with the specific medication, and don't mix and match. If it doesn't come with a dosing tool, you should always ask your pharmacist or doctor to give you one to use. A lot of times, if you're filling it at the pharmacy, the pharmacist should be giving you these oral syringes. Make sure that they are the right size as well. That should be on them to determine that. You should never just use a spoon from your drawer in your kitchen. Never use teaspoons, tablespoons, or other household spoons to measure medicine. It's not accurate. Be sure to use a dosing tool that is just right to fit the dose you want to measure. The tool should not be too big or too small, as I was talking about with the syringes. It's very hard to measure a half of a milliliter dose with a 20 milliliter oral syringe. So make sure that it's the proper sized tool to measure the dose. Medicines can be measured in different ways. Again, you may see teaspoon written after the amount that you're supposed to give. You may see tablespoon. You may see milliliters on the dosing tool. It's easy to measure the right amount with a dosing tool that uses milliliters instead of teaspoon and tablespoon, because that gets mixed up a lot. Look very carefully at how the dose amount is written, and be especially careful if you see a period in the middle of a number. So for example, 0.5 milliliters is not the same as 5 milliliters. Mixing these up can mean giving either a 10-time overdose of the medicine or 10 times less of the medicine that you're supposed to give. You should always ask questions. Many parents have trouble understanding medicine instructions. If you're confused about how to give your child the medicine, it's better to ask questions than to give the medicine incorrectly. If you're not sure how much medicine to give your child, talk to your doctor or the pharmacist. Also, before leaving the pharmacy, make sure you ask the pharmacist to show you how much medicine to give using the tool you plan to use at home. So have them, if they're including the syringe into the package with the antibiotic or the medicine, make sure they show you how much to draw it back to before giving it, just so you can also see that. Sometimes it's also helpful to mark a line on that syringe as well. You should keep your dosing tool with that medicine so it's easy to remember to use them together so they don't get separated. Keep them up and away and out of sight of young children. We also recommend locked medicine boxes as well, because up and away doesn't necessarily make them unable to access it. But that way it ensures that they don't get into them when you're not watching. Next slide with medicine cups. So they are best for children or adults, bigger kids, adults who can drink from a cup without spilling. Make sure you use the cup that comes with the medicine. So a lot of times specific medicines have a cup that's specific for the dosing recommendations for that medicine. So it's not just a generic cup that you can interchange with a lot of medicines in most cases. They often come over the lids of liquid, cold, and flu medicines. Don't mix and match cups to different medicines, I said. You might end up giving the wrong amount. Don't just fill it up. Look carefully at the lines and letters on the cup. Use the numbers to fill the cup to the right line, and make sure you're reading the label beforehand to make sure that the dose is the right one for you. Ask your pharmacist or doctor to mark the right line for your child if you're not sure. Always make sure you put the cup on a flat surface like a table to check if you have filled it to the right amount, so it's not crooked, or holding a cup tipped or at an angle makes it easy to measure the wrong amount. And the liquid may look slightly curved. Make sure that the bottom of the curve is called the meniscus is on the desired dose marking, kind of like this picture shows here. All right, next slide. Prescription medication in kids. Make sure your pediatrician and pharmacist know your child's weight, their allergies, and all of the medicines they're taking, including other prescriptions, over-the-counter medications, herbal products, vitamins, supplements, or any home remedies. Contact your doctor if you have any questions regarding your child's medications, such as how much your child can take, drug interactions, and food interactions. Don't hesitate to ask your physician or pharmacist and voice your concerns. Check your labels. When you pick up your child's medicine from the pharmacy, make sure that the label lists the medication your doctor prescribed and the proper dose. Ask about dosages. If you have a question about the dosage, always ask. So for example, sometimes the label will say 4 doses daily. Does that mean every 6 hours around the clock or just during waking hours? So that's a question for the pharmacist as you're filling it. And you should always finish your prescriptions, especially antibiotics. If your doctor prescribes them, make sure that you give your child the full course, even if they start to get better. Stopping them mid-course can give lingering bacteria a chance to grow back, resulting in the need for even stronger antibiotics.
All right, thanks very much, Justin, for your expertise and tips. I'm going to just talk through a few more slides here. We want to make sure that when we give medicine to children that we do it properly, and we all know that that's easier said than done if you are a parent and have a squirmy toddler or baby. It can be a challenge. So for infants newborn to 1 year old, you want to really think about what would work best for your baby. And there's different things that can be tried, but really with that age is the oral syringe, as we talked about. Again, that syringe without a needle, and let the infant suck on the medicine out of the syringe. You don't want to do a forceful squirt, which can cause them to choke, especially in a young age. Small amounts at a time, let them kind of pull the medicine out of the syringe, and then make sure you have them swallow before giving any further doses, and give the medicine right before a feeding, unless encouraged by your doctor or healthcare provider not to, because that's when they're most hungry and more likely to swallow medication when they're infants. And then you want to avoid mixing medicine with food. Lots of parents like to use maybe a bottle or a sippy cup or other types of things, especially in a young age. If they don't finish that product, then they're not getting their full dose of medicine. Or potentially another child or unsuspecting person can get into that medicine unintentionally. And for children over 1 year, it really is more about how you prep them for it. Your attitude about medicine and how you talk about medicine is really helpful. Kind of preface it as something that they need to do, and it may not taste good. We get that, and as parents, we can use things to kind of mask some of those tastes, and even that's something at the pharmacy that can be done sometimes with flavorings and things that they add to liquid medications, especially with children who are adverse to regular medication. You want to give the medicine directly from a pediatric measuring device, such as that syringe, or for older children, the cup, not using, other, cups and containers. The only other thing maybe though is for older children that have tablets that are crushed, are safe for crushing, and you'll know that by reading the label or speaking with your pharmacist or physician. You can put that in something like a soft food like ice cream pudding or applesauce. But not in things that typically you want them to eat, like their meat or vegetables, something more like a little treat or a palatable thing. And then small amounts is best, and make sure that they finish the entire amount. So you just want to put a very small amount on a spoon, as opposed to in an entire, cup of ice cream or pudding. And so, of course, how we talk about medicine with kids is very important, especially when they're older children, preschool age and up. We never want to call medicine candy or use sort of scare tactics to get children to take medication. And we never really want to use threats like you'll have to go to the doctor or you have to get a shot if you don't take this medicine, because we know that that can be very scary to children and very confusing. And we want to have medicine be a safe and monitored experience. So it is important also that you know the number to the poison helpline. The Missouri Poison Center is one of 53 poison centers across the country, and our number is the same no matter where you are. It is 1-800-222-1222, and it is staffed by registered nurses and pharmacists like Justin and others who are free and available to be called any time of day or night, whether you have a question about medicine or you have made a dosing mistake or another poison exposure. So we're available 24/7. Again, that number, please save it in your phone, is 1-800-222-1222. Thanks for joining me, Justin, and hope you guys all stay warm today.
Thanks, guys. Stay safe.